Your patient is Joan Smith. She is an 80-year-old female who's admitted on 3/18/2013 with a diagnosis of exacerbation of congestive heart failure. Her past medical history includes congestive heart failure, chronic obstructive pulmonary disease, and non-insulin dependent diabetes mellitus. Her allergies include penicillin. She is currently experiencing dyspnea on exertion and is unable to carry out ADLs. Her vital signs are Q4 hours. Her activity status is out of bed as tolerated. Her diet is an 1800 ADA diet with a fluid restriction of 1,000 milliliters per day. Her IV is to saline lock. She is required to have daily weights. She is required to wear pneumatic compression devices to bilateral lower extremities. Her oxygen is 2 liters nasal cannula. She is on strict intake and output. She gets blood glucose monitoring before meals and at bedtime. Her lab work is a complete blood count with chemistries, SMA-7. Her medications include Lasix 40 milligrams PO twice daily and glucophage 850 milligrams PO twice daily. We will now proceed to the CCC where you can create your nursing plan of care. This is the dashboard where we are going to enter the patient data that can be found in the electronic medical record. Check patient data. We will start by entering the patient's last name and then the first name. We will move to age. As we know, she is an 80-year-old female. Her birth date is January 9th, 1933. This patient is a white, non-Hispanic female. She is married and living with her partner. We will now enter the primary medical diagnosis, exacerbation of congestive heart failure, or CHF. You can also enter the past medical history at this time, which is CHF, COPD, and non-insulin dependent diabetes mellitus. Her allergies are to penicillin. She was admitted on 3/18/2013. She lives with her spouse. Her significant other's name is John. John is the available caregiver. John is able to comprehend English and able to communicate English. This will be important as we determine discharge instructions for the patient. We can add this patient by pressing the Add New Patient button. Now we can exit out. Once you've entered the patient data, you may now create the plan of care for your patient. Press the Enter CCCS button, and you will see a screen in front of you. Please look at the patient name and verify that this is Joan Smith. We have developed a nursing diagnosis for this patient related to her exacerbation of congestive heart failure. We've determined that activity intolerance will be her nursing care plan. If we click on Care Component, we choose Activity. Care Category then gives us the functional pattern that's related with activity. We then can proceed to Diagnosis, and we have 2 diagnoses to choose from. If we click on Activity Alteration, we will see the definition for this is change in or modification of energy used by the body. If we click on the alternate, we see that musculoskeletal alteration includes change in or modification of the muscles, bones, or support structures. We have determined that this diagnosis of exacerbation of CHF is related to activity alteration. We can scroll down to see if a subdiagnosis is warranted, and we have determined at the moment that activity intolerance is going to be our choice for our subdiagnosis. When we look at related to, we may type in the definition, which is the inability to carry out activities. We may put in, as evidenced by, our patient's characteristics or signs and symptoms that they are showing us that relate to their activity intolerance. Joan Smith has dyspnea with little activity, and she's not able to carry out her ADLs. She also reports feeling fatigued and weak. She has dyspnea and increased heart rate with activity. Remember that signs and symptoms are subjective data as well as objective data. We're next going to move on to our expected outcome for our patient. We would like our patient to improve once we implement our interventions. We're now going to the intervention box to determine what we would like to do for our patient who has an activity intolerance. We are going to choose activity care. With that definition, actions performed to carry out physiological or psychological daily activities. We then are going to determine if there is a sub-intervention which comes up as energy conservation. This will be the focus of the types of actions that we select. We go up to the type of action box and check all that apply. We would want to assess, monitor, evaluate, and observe our patient. We would want to perform care, provide, or assist with any care that our patient may need, or we may want to teach, educate, instruct, or supervise our patient with any education that we may give to them. We may first assess the patient by looking at their activity level and vital signs, as we know that baseline data is appropriate when determining where to start with our patient. We might document from a Craven book. We may document from something that we learned in lecture class. We may document from another nursing care plan book. The next intervention that we may do for our patient is related to care. We want to limit the patient's activity after meals. The rationale for this is because blood flow is directed to the digestive tract, which increases the workload of the heart. We would also like to continue to monitor vital signs during and after activity, and our rationale is because sudden changes in vital signs indicate activity intolerance and provide parameters for future activity. We may reference to Craven 2013, Chapter 26. Additionally, we may want to provide patient teaching. This may require that we teach the patient to gradually increase their activity to help build their endurance. Again, we may find this information in our Craven textbook and document this Craven 2013, Chapter 26. The actual outcome is not going to be determined at this time because you have not implemented these interventions. We are going to click on Record this entry and OK. This will then document our patient's problem, their diagnosis, the type of actions that we plan to take, and the interventions in progress. Now we can close, and you are finished. Once you have implemented your interventions, you can go back into the CCCS, check to make sure that it is your patient, Joan Smith, return to display. Actual outcome can be documented as improved if you have seen improvement in this patient. You check the box for resolved, complete the entry, and you will see the status has been changed to resolved. You can also print this report. As you press the report button, what you see on the screen is the individual care record. Before you print, make sure that this is in fact your patient, Joan Smith, and these are the problems and interventions that you have identified for this patient.